The second system or adaptation system that we have for our body that controls blood pressure is controlled by the kidneys, and it's called the RAAS system. It is the Renin-Angiotensin-Aldosterone system. Now, the way this works is a little different than the sympathetic nervous system, because the sympathetic nervous system is controlled by those catecholamines, so those adrenaline, that causes direct vasoconstriction for the heart and the vascular system. But this is controlled by the fluid and electrolyte balances in our body because it's done by the kidneys. And that brings me to my next point. One of the neediest organs in our body is the kidney. It takes 20% of our cardiac output. So when there's a decreased perfusion or decreased blood flow to the kidneys stimulate this system called the RAAS system to increase the blood pressure. Because think of it like a garden hose, right? Where you have the garden hose, and then when you put your thumb over top of it, it increases the distance that blood goes, right? So think of it, when our veins constrict, it can increase the distance that blood reaches, so that way it can reach the kidneys. So think of it that way, as how our bodies compensate when there's a low blood pressure. So when there's a low blood pressure, our kidneys aren't getting enough perfusion, so our kidneys are going to stimulate this thing called the RAAS system to make sure they get enough blood. Hey guys, it's Wilker Patrick, nursing educator inside Coursera. I wanted to let you guys know that I will help you with anything you need at any time if you just send me a text at 940-218-4062, 940-218-4062. Let's get back to the video. All right, so let's go over what the heck renin, angiotensin, and aldosterone even is. So renin is the enzyme that is found in the kidneys that gets stimulated when there's not enough blood flow to the kidneys. So what renin does, it then transmits and communicates that we need to create a vasoconstrictor called angiotensin 1. Now, it doesn't stop there. Angiotensin 1 will help. It will increase the blood pressure by constricting those vessels, but then it wants to convert into something called angiotensin 2. Now, how we convert with that, write this down, is something called angiotensin converting enzyme. Now, this is actually mostly done in the lungs, where it gets converted from angiotensin to angiotensin converting enzyme to angiotensin 2. Now remember, angiotensin 2 is a potent vasoconstrictor, so it's going to increase your blood pressure. All right, and then once those are stimulated, not only does that do the vasoconstriction similar to the sympathetic nervous system, it doesn't stop there, because the kidneys also want to hold on to water and sodium. So what happens when we increase the water in our body? Well, it's going to, of course, fill up those veins, right? Which then, of course, increases the pressure in that vascular system once again. So not only do we have vasoconstriction, we also have increased water that is staying in the body because our kidneys stimulate something called aldosterone. All right, so aldosterone stimulates the hold, so it locks up those kidneys and holds on to water and sodium. Now, aldosterone also helps excrete, so it promotes the excretion of potassium. And it also holds on to bicarbonate, which helps prevent the buildup of acidosis. So remember, aldosterone, water retention, sodium retention, bicarb retention, which is our alkaline base of our body, and then it promotes potassium excretion. All right, let's back up and just recap all of what I just said. The RAAS system is controlled by the kidneys, and our kidneys help regulate our blood pressure through this system. So the kidneys take 20% of our cardiac output, and when we have decreased blood flow to those kidneys, they get mad and they stimulate the RAAS system. So what happens is they stimulate renin, which is an enzyme inside the kidney itself that stimulates the process of turning it into angiotensin 1, and then that angiotensin 1 needs an ACE enzyme, so ACE converting enzyme, that turns it into angiotensin 2, which is a potent vasoconstrictor. So it increased the blood pressure because think of it like the garden hose analogy, where you put your thumb over it and it reaches a further distance because the pressure has increased in that vascular system. All right, it doesn't stop there. It's going to also stimulate something called aldosterone. That aldosterone increases water, sodium, and bicarbonate. Now, most importantly, to increase the blood pressure, it needs to hold on to water, because the more large of volume that we have in our vascular system, the higher the blood pressure is going to be as well. And then, of course, it's going to promote the excretion of potassium, so you're likely going to have hypokalemia and result when aldosterone is stimulated. Hey guys, first of all, thank you so much for watching the video entirely through. It makes our day if we know that nursing school got a little bit easier after watching one of our videos. If you guys like this video, make sure you like it, subscribe to the channel for more, and drop down in the comments for any more ideas that you need help with nursing school. If you want to contact me personally, it's 940-218-4062. Thank you guys for watching. We'll see you in the next video.